And the second series that I'm going to show is an interactive data visualization. And the data that I'm using come from the United Nations Millennium Development Goals in 2015. So the first variable that I was interested in is the percentage of the population that is suffering from undernourished condition. And this is a simple histogram. It's animated, so if I click the play button, you can see the histogram changes over the year. And something that I thought was interesting is we see this histogram is that back in 1991, we still had countries that fall in the category of 80 to 100% of population undernourished. But in a little bit, when this animation stops, the year 2015, here, we don't see any country in that 80 to 100% category anymore. We also don't see any country in the category of 60 to 80%. So what that means is that over the course of about 15 years, the status of the world has improved so that we don't have any country in the category between 60 and 100% of the population undernourished anymore, which is a good thing. Now the bad thing is, as late as the year 2015, we still have countries that fall into the category of 40 to 60%. 60% of the country population undernourished is a significant thing, and something should be done to address that issue. So those are the two key takeaways from this visualization. Then over here, I took the same variable, I displayed it in a map of the world, and now the regions are colored based on their level of population undernourished from 0% to 100%. So the first thing that jumps out at you is probably that the region down here seems to be the region that suffers the most, and that happens to be Africa. And this is the year 2015. The viewers can actually change the slide of the year to the population undernourished over a 15-year course from 1990 to 2015. So I'm going to go back to the first year here, which is 1991. And we can see that the population of Africa seems to be suffering the most during that period. Then we have a few other countries, we have other countries in Asia that suffer as well, and some in South America. So those countries would need help. Then fast forward to the year most recently, the situation improved significantly. We only see, for the most part, we only see Africa and some country in Asia. Now, if the audience, if the viewer, I should say, is interested in looking into different regions, it's possible to zoom into different regions and look at these different countries to get an idea of what specific countries are in trouble. So if I'm interested in this little country right here, I can zoom in, I can click on it. It tells me that it's Central African Republic, and for the year 2015, the percentage of population undernourished was 47.7%. And so the pop-up window is helpful in that sense. Then, according to the 2015 NTG report from the United Nations, a lot of countries managed to climb out of poverty for some part of its population, but then the population kind of slipped back into poverty right away. And the reason is that poverty and hunger reduction in this case, go hand in hand with other factors such as education, access to sanitation facilities, clean water, that kind of thing. And so that's why I'm interested in showing the population not using improved sanitation facility. And the reason why there's a negative in there, not using improved sanitation facility, is because I'm interested in showing the countries that are in trouble. So the population not using improved sanitation facilities are displayed in circles. So these are the circle markers. And the bigger the circles, the lower the percentage of the population that has access to improved sanitation facility. So for example, I zoom in, I click on the circle, it tells me the countries is Ethiopia. The percentage of the population that has access to sanitation facility is 28%, which is pretty low. Now, what happens to countries like the United States and Canada, where the population that has access to clean water is pretty high? There's a dot here. It's so small that we can't really see it easily, and in fact, I can't really click on it. because it's so small, and the reason is that the population that has access to clean sanitation facility in the state is so high that the circle is small, and that's a good thing because that's where we are right now. Another observation that we have is that if you look at the population having access to sanitation facility and the population undernourished, there seems to be a correlation between these two variables. So Africa seems to be the place where a lot of countries need help with their sanitation facility. It also seems to be the place where a lot of countries need help with the population undernourished. And so there seems to be a trend going on here, and I think that it's an important thing for research organizations and NGOs to look into when they create sustainable development programs in the future. And I would like to say that this interactive data visualization is not perfect. There are a lot of missing data, which I will talk a little bit about in the conclusion. But there are missing data, and some of the countries' names do not display correctly due to that issue. So this is not perfect. And that's the end of what I have to say.
Okay, any questions or comments to this couple of very, I think the planning TV, including the interactive with many countries across the world. Any questions or comments?
A general question on the previous presentation. In your mind, why do you think Giang has the best health compared to relative to the rest of the country? You know, like the lowest mortality rate and so forth.
You're asking why I thought that North Korea has.
No, like the city of Giang. Why do you think it has the best, the lowest rates?
Oh, it just
right, compared to the rest of the country.
Because due to the legend years of the prevalence of the disease, prevalence of wasting in children, so the lighter the color, the lower the prevalence.
Is there a reason for that though? That's what I mean. Is it like is there like healthier people there compared, or they have better access to facilities, or?
There's a couple of visualizations that our team created, which, by the way, I'm not the one who created this, but one of our team members did. And there are a couple more visualizations that our team created in the past, and one of them that I'm not showing here shows the migration from provinces to other provinces, and you can see that a lot of citizens actually try to migrate to Pyongyang, which is the capital, and my guess is that the citizens of that capital has better access to health facilities. Maybe there's more money going in there. If the seat of power is where the leadership is, and so those are possible explanations why the health status is so different there. Seems like the citizens there experience a somewhat higher privilege level than the other provinces.
I think that particular interactive TV Giang mentioned is likely to be included in a paper that will be published.
It's next year.
Oh, it's next year. Okay, you're going to show that?
Yes.
Okay.
Spoilers.
It would be interesting to take that one further. It would be interesting to look at various hypothetical reasons as to why these measures are better in the capital area, such as an increased number of facilities, increased expenditure, and so what the actual graphically show, perhaps, or create a graphical manner of showing what these, whether a proposed hypothetical cause really seems to bear fruit in this case.
That's right. Yeah. Okay. Thank you. So let's. Oh, one more question.
I'm really like the map with the upper one. I'm curious, is that since you show the different map over time, is that possible? Is that dynamic change over time?
Sorry, I'm not really clear.
Yes, is that possible? Is that change? Dynamic. Change over time. Is that kind of interactive function? Yeah.
Oh, just like a histogram.
Yeah.
I tried to do that. It wasn't successful. So this one is not perfect. So it was possible for me to include a play button like I did for the histogram.
Yeah.
But since I used R Shiny to do that, and every time that the time was changed, the map was redrawn, so it created this flashing effect that I couldn't figure out a way to fix. So that's why I didn't show you.
It's argument.
But you got me there.
Okay, thank you. Okay, thank you, Giang. Let's turn to the next panelist, Star. And Star, I think the may focus more on